important thing here to know is that they also tend to have more aggressive cancers than the women. And the other thing is, since their breast is not very developed and it is not as, the size is not as large as for the women, you'll find it is likely to invade other deeper tissues because the breast is more superficial. So it can invade other deeper tissues very easily because it is very opposed to the chest wall. But it is a very important cancer. We have a lot of men that we treat for cancer. And the important here is for men to appreciate that men can get cancer. When we tell women to check, even men should also check. Yeah.
Okay. I know we'll be getting to the part on how can I be able to check, you know, and find if I'm okay in terms of breast check for cancer. And let's now get to what causes this. I know you've mentioned about abnormal multiplication of cells, but let's get deeper into it. For you to be told now you're diagnosed to have cancer, what is happening, you know, around the breast?
That's a very good question because that is what brings us to the next level of what you can do about it. But you'll find, I've mentioned all the structures that are found there, and those may give kind of cancers. You know, cancer is not one disease.
Yes.
Cancer is a whole it's a whole lot of different diseases, but with the same mechanism. But the most common cancers that you think about, especially in men and females, are what we call the ductal carcinomas. Ductal cancers are the ones which start in the milk ducts. You know, the milk ducts where the milk is formed. Or in the lobules where the milk is formed and the ducts where the milk goes through. Those are the most common ones. And you'll find the most common causes or the risk factors that are associated with it is the hormones. It is a very hormonal disease. That is a very important factor there. And you'll find some of the risk factors there is girls who get their menses when they are very young, women who get to menopause very much later in life, women who don't breastfeed after getting children, also women who have never given birth. They are also at an increased risk. Women who have who are given hormone replacement, especially when they go through hormone replacement to alleviate menopause. And the thing here we are saying is because there is a prolonged exposure to the female hormone. You get your menses very early, your menopause is very late. You have many years of exposure. You look at all those causes I've given there, they are reflecting that, the exposure. But not the. We talk of a healthy lifestyle. So we are talking of obese people tend to have a higher incidence of cancer. People who live a sedentary life, who take alcohol or smoking, those are factors that cause. Environmental factors. There are those girls who have been treated with therapy or radiation before when they were young. They are cancer later in life.
What do you mean by that? When you say you've been treated with radiotherapy?
It is a form of cancer treatment. And the most common cancers we would talk about are some of them like what we call the lymphomas. And they get radiotherapy to the area of the chest. That exposure of the breast to radiation, to those low levels of radiation, predispose them to getting cancer of the breast later in life.
And it's not X-ray.
It's a form of X-ray.
It's a
form of X-ray. Actually, that is what the other reason and we'll come to when we diagnosis. You'll find when we said ladies for mammograms, which are X-rays, we tend not to use mammograms for the young ladies because of avoiding exposure to radiation at the early age when the breast is developing. Yeah.
Wow. You know, you're mentioning things that sound, common.
They may be common to some of us,
But it's like
yes.
alarming, you know. A viewer could be thinking, wow, I think I've done that. I've done at least that, you know. So am I at risk? So you don't need to worry. You can send us your question on 22232. That is 22232, or at Hope TV Kenya. That's on Facebook and YouTube. But the comment section, drop there your question. And Dr. Anthony Ndiritu, who is an oncologist, will be glad to answer any question that you have. Remember, we are discussing about breast cancer. So is there another cause maybe that you've left out?
I've talked about the hormonal causes. I've talked the environmental causes. There are also other genetic factors. You'll find what we call the mutation of the genes of a person can predispose them to getting cancer more than the people. So those we call familial cancers. You'll find certain cancers run in the family. If you find you have had a sibling who had breast cancer, and then you may go back into the family and find there is an auntie who had the same breast cancer and all that. So those are cancers that run in the families, and that is because of the genetic makeup of these people. The others is just the general environmental factors that predispose people from all other types of cancers. Remember, the lifestyle of people has changed. People don't exercise a lot. We drive to work, we park at the door, get in, get out. We don't exercise. People smoke. People are exposed to also all industrial toxins and fumes and all that. All those play a factor in causing many of the cancers. Yeah.
Okay. So what are some of the symptoms, you know, that you look out for in order to determine if one has cancer or not?
This is an important question, but it is a question probably maybe I'll try to focus it more to the breast cancer.
Yes.
Because different cancers will present differently depending on the location of the cancer. But when we specifically come to any cancer, first of all, we look at the symptoms that are caused by the local effects of the cancer at the site where it is, and those that result from other chemicals that the cancer may produce, and also those that result from cancer spreading to other areas.
Yes.
But if you come to the breast cancer, you'll find the most common thing, you'll find a lady will say, my breast one of my breasts is larger than the other. Maybe the breast is tender or it's painful. You may find changes on the skin. It may become red, more red. You may find some changes on the skin like dimpling, meaning there is something growing in beneath the superficial tissues. You may have what we call an abnormal discharge from the nipple. Either it can be a bloody discharge, it can be a milky discharge, it can be a green discharge. Anything that is not your usual should concern you. Breast pain is another one. The other thing is effects that may result from cancer that has spread to other areas. Remember, cancer of the breast can spread to any organ. They can spread to the lungs. Somebody can come with a cough or coughing blood or something like that. Yeah. You may have cancer that has spread to other parts and present with pain, maybe bone pains and all that. So largely it will depend on where the cancer is and where it has spread to. It also depends also on the stage of the cancer. That is, how big is it? What effects is it causing in the local area? And that is what would trigger you to think about it. The other thing is, you may detect a lump in your breast when you're maybe taking a shower, or if you routinely examine your breast, you may feel something that is abnormal. And here what we say as we talk about the symptoms, most likely it may be discovered by you or even your spouse in the course of just normal touching of the breast. You may feel something abnormal. So at that point, what we encourage ladies is that you should get into a routine of check. And that is the way you will know this is not normal. Yeah. But if you don't regularly check, you will not know what is normal for your breast or not. Yes.
And you know, you're talking about checking. So are you able to give guidelines on how you can do routine check to know if there is a lump or not?
Yes.
A lump that is to give you worry.
Yes, that is true. And what I have said, the first thing is to be aware of your breast. It is you who knows what is not normal. Being aware means if you look at yourself in the mirror, you can be able to see, am my breast symmetrical? Is there any change? Is one looking grossly bigger than the other? Does the skin look normal? Those changes that I've talked about.
Yes.
That is the first thing you check. The other thing, you come now to the actual examining of your breast, what we call breast self-examination. Yes. That is the first step. And the self-breast examination is something you are taught by a healthcare worker so that you know what you check for and how do you check. We don't have a patient here where we can demonstrate, but it's something that we can explain so that the viewer can tell, yes, this is what I need to do. So basically what we do is that, like what I've said, you stand in front of the mirror. You can hold your head like that. Yes. That will help stretch the chest wall so that you're able to see the breast. Or you can put your hands there. That will be able to stretch the muscles. Yes. Then what you usually do is that when you come to the actual examination, you divide your breast into 4 parts, just from the center, 4 quarters. Yes. And those quarters, we call them quadrants, because you want to examine each and every quadrant so that you don't miss anything. Then when you come to the examination, you have to be methodical. You start from one quarter, you go to the other one, you go to the other one, you go to the other one. And after that, you go to the central area. And remember, when you come to this quarter, the breast extends towards the armpit. So you have to go to that's the armpit area. Then once you're done with that, you have actually to check for the glands in the armpit. And then above the collarbone, because those are the areas where cancer of the breast can spread to. And when we come to the examination, there is also a technique of doing that. Yes. And the technique is that you don't use the tips of your fingers. If you use the tip, anything, yes, you will miss a lot. So we use the flat part of your finger. Yes. And you just put it firmly on your breast.
On every quarter.
On every quarter. Remember, you're pressing it on the chest wall. Yes. So if there is something between the chest wall and your fingers, you'll be able to feel it very well. So you go methodically, go to the next one, like that. Go to the next one. Remember, for this one, we are going up to the armpit level to follow we call it the axillary tail. Yes. It's the breast which is extending to the axilla or the armpit. So you check that. Then come to the other one, the same thing. Then once you're done that, come to the central area. Okay? Yes. And then once you're done with that, use the other hand. Remember, when you're examining, you can do that, yes, so that you stretch the muscles so that you're able to feel the breast. Once you're done with that, go to the armpits, go to above the collarbone. That way you'll be able to do that. But it is that the breast self does not the clinical breast examination. Not that because you have been examining yourself at home, you don't go to the healthcare worker to have you checked. Yes. You need to be checked because they are professional, they are taught how to do it. They may get something that you're missing on your examination. But the importance of you doing your examination, you may be able to detect something quite early. Yes.
Wow. It looks something that each one of us can be able to do at home, to do the self-examination. That also applies to men.
Yes, yes.
Yeah, the self-examination into quarters and go around in a circular motion using this part, yes, of your hand and, yeah, keenly checking.
Yes.
Yeah.
And do it regularly. Remember, you take a shower every day.
Oh, yes.
You have a mirror there every day. Take a few minutes before you shower. And that way you'll know something that is different. Immediately it comes up.
Okay. Yeah. So I've done, for example, I've been checking regularly, and on this day I discover, I think there is something I'm feeling. Yes. What will the person do?
Exactly. And that is the essence of doing the examination. Because you want to feel something that is, you don't want to feel something abnormal, but you're hoping you don't. But now, yes, on this occasion, you have felt something. Once you feel something, you need to go to the hospital. You need to talk. He needs to do an examination himself. After he does the examination, If there is truly something abnormal, then you will be sent for the tests. And what tests are we talking about here? The test we are talking about here is, first of all, to confirm what is that swelling that is there. If you are in the age bracket where we do mammograms, we'll send you for a mammogram. A mammogram is a special X-ray for the breast. So the mammogram will be able to show us, is there a lump there? Or is there a lump in the axilla or in the armpit area or those other areas that I've talked about? So once the mammogram is done, if for sure there is been seen, the next thing we want to make note, we want to do what we call a biopsy. A biopsy takes some tissue or some, we may call it a piece of meat from that lump that you have seen.
Yes.
And we use a special needle. So they'll do a scan, like an ultrasound, so that they see where the lump is, put a needle there, come out with a small piece of tissue, which is then taken to the laboratory to confirm, is it cancerous or is it not cancerous? Remember, most lumps are not cancerous. So that is why if you feel a lump, it doesn't mean you have cancer.
Yes.
So that is why we have to confirm what that lump is. Remember also, because of the hormonal changes, the fluctuation of hormones in the course of your cycle, there are times you'll feel some lumps, but they're just hormonal. And the next part of your cycle, the lump will disappear. So that is why it is important to have the doctor check, do the special tests, confirm. And then once we have confirmed that, we have confirmed there are some cancer cells in that tissue, then we go to the next to find out, has this cancer gone anywhere else beyond that lump? And how do we do that? We do scans. We make the chest and the abdomen. That can be either a CT scan. In the form, you may do an X-ray of the chest, an ultrasound of the abdomen, but preferably a CT scan of the chest and abdomen. And that will give you the status where the cancer commonly goes to. And that is what we call staging.
Yes.
And that will give you now the stage of the cancer. And the stage of the cancer here is, how do you determine it? You determine it by the lump that you have seen. What is the size of the lump? How far has it extended? That gives you the tumor stage. That is the size of the tumor, and whether it has involved the chest wall or it is involving the skin. Then the other thing is, you remember I talked about the glands that you find?
Yes.
Those are called the lymph nodes.
Yes.
So the stage also has the part of the lymph nodes. We want to see which lymph nodes are there. If the nodes are not there, then we know, we call it negative for lymph nodes. So we say it is N0. Yeah?
Yes.
If once you confirm that, then you look for what we call M. M is metastasis, meaning has it spread?
Okay.
And that is where we are doing the scans.
Yes.
If we find it has gone to the liver, then we know the stage has gone higher.
Higher.
If we find it has gone to the lungs or to the bones, then we know the stage is higher. But the important thing of staging here, because when you see a patient, the first thing they'll ask you, what is the stage of my cancer?
Yes.
And I tell my patients is that the stage is more important to the doctor to be able to make a decision on how to manage your cancer. Because sometimes people are fixated on the stage. And the stage does not really reflect necessarily the outcome. And that is why I say it is more important to the doctor to be able to decide on an appropriate treatment for you. I don't know whether I've gone beyond what you would want to.
So
Yes.
what you're saying, Dr. Anthony, is for you to know the stages, there are several tests that you have to go through.
Yes.
And that will determine this. So stage is majorly to help the doctor know what kind of treatment
Yes.
you need.
What is the best treatment for you?
Okay.
Yes.
So you have mentioned if it's you've mentioned about what determines stage 1. If it has spread, is stage 2. So what determines stage 3, stage 4, if there are any? Up to what stage?
I've not even said. I've not even said that.
Okay. What determines what stage?
What I have said,
Yes.
I've just given you How we stage cancer,
Okay.
we stage using three things.
Yes.
The tumor itself, that is the original tumor,
Yes.
the nodes, and the metastasis. Metastasis is those other areas where it has gone to.
Yes.
So those three things will help us know whether it is stage 1, 2, 3, or 4.
Okay.
Cancer of the breast, we stage it into 1, 2, 3, and 4. Okay?
Yes.
And 1, 2, and 3, they mean the cancer has not spread to other distant organs. Stage 4 means it has gone to other distant organs.
Okay.
Either the lungs, the bones, irrespective of the size of the original tumor.
Okay.
Even if the original tumor is very small and then we find something in the liver, that is stage 4. Even if we find a big cancer here and has not gone anywhere else, that is not stage 4. It may be now the lower stages.
Yes.
And the reason why I'm highlighting this is that sometimes the more advanced the cancer is, the more difficult it is to treat.
Why is that so?
And it reduces the chance of cure. The reason being, the more advanced it is, the more likely it is to recur, the more likely it is to spread to other organs. Of course, if the cancer is stage 4, we say that is not curable. But saying it's not curable does not mean there is nothing that can be done about it.
Yes.
And that's why I said the stage is more important for the doctor to choose for you the appropriate treatment.
Yes.
Yeah, but to summarize is that we have 4 stages of cancer, depending on the extent of that cancer and how far it has spread. And that guides now the doctor, of course, together with the patient and the caregivers to decide on the appropriate treatment.
Okay. We'll be getting to the treatment and how that is done. But you're on Health Check right here on Hope TV. Look and Live. My name is Grace Mutiso. I'm hosting Dr. Anthony Ndiritu. He's an oncologist today, and we're focusing on breast cancer. If you have any question, of course, our numbers are right at the bottom of your screen. That is 22232. That is 22232. You can drop your question right there. We'll be getting to answer you in a short while. You can also get us at Hope TV Kenya. That's on Facebook and YouTube. By the way, we are live. Remember to share the link with someone who needs to learn about breast cancer today. Share with your spouse, share with your neighbor, your friends, and let's learn together. And on the comment section, of course, you can ask there any question that you have. And of course, Dr. will be glad to answer you in a short while. Before we get to a break, what are the risk factors of breast cancer, Dr.
The risk factors, I believe we have touched on them a bit when we were talking about the causes of cancer. And here we look at them in terms of hormonal factors, environmental factors.
Yes.
And hormonal factors, I talked about them. If you have, if you a lady who has never delivered, if you don't breastfeed your babies, you are at an increased risk. Those who have hormone replacement treatment, we have talked about those ones. I said about those who get periods very early and those who get late menopause. Then the other thing which is very important is on exercise. Remember I talked about inactivity, I talked about obesity, that sedentary life, and avoiding that unhealthy diet. A lot of fatty foods and all that. Those are the major risk factors that we may think about. Yeah.
Let me talk about one. Let me pick one that you've mentioned about either a mother who is not breastfeeding, or a lady who's not gotten children. Lest we be misquoted by our viewers. Dr. said, if I don't have a baby, I risk getting breast cancer, or if I don't breastfeed my baby, I get risk cancer. Is it like a must, or there is a tendency that could happen?
Remember, when we talk about risk factors, we are not calling them causes. We are calling them risk factors. How do we establish what are risk factors? It's through research.
Yes.
And you look at statistics. How many women who have not breastfed get breast cancer? And we said breast cancer is also very most of them are hormone sensitive.
Yes.
Yeah, so it does not mean they will get, but increased risk. Remember, there is somebody who will have got their periods much later, they get post early, they have 5 children, and they get breast cancer. And another one who has never got children, has never breastfed anyone, is obese, and does not get breast cancer. But we're saying it's just like the way you're told to drive carefully.
Oh,
yeah?
yes.
But it's not always that those who drive badly get an accident. But you not drive badly, because even so drives recklessly and has never had an accident. So it is better to be safe. Yeah, at least you know you have done your part. You have reduced the chances as much as possible.
Yes.
You may think that I got breast cancer maybe when I was 50 and I was given this or the risk factors and I had avoided that. Probably if you didn't avoid that, you would have got it at 30. So that is why it is good to protect yourself. Do exercise, eat healthy diet, avoid obesity, become active, avoid smoking, all that. Yes.
Okay.
Then remember, some of those things you may not control. The other thing we didn't talk about, a risk factor, is age.
Yes.
Age is a risk factor. Being a woman is a risk factor because it's more common in men.
Yeah.
There are things that, if I said, in of course, viable causes.
Yes.
And if you're at risk, remember some of them you may not modify. What does it cause you to go for more regular screening and checkup, so that if you are at increased risk, then in case there is anything, it is detected earlier and it is managed earlier.
Okay.
Yeah.
Thank you, Dr. Anthony. Allow us to have a quick break. When we come back, we'll be sampling your questions on 22232. That is 22232. And at Hope TV Kenya, this is Health Check right here on Hope TV. Look and live.
The RAF is in Nairobi. The RAF is a chance to showcase your talent in music, dance, poetry, acrobatics, and many more, and stand a chance to win 500,000 Kenyan shillings, a recording deal at Hope Studios, and many more prizes. The RAF is a space for talented youth between the ages of 18 and 24 years. Auditions in Nairobi will be held on Thursday, 26th October 2022 at Siton Valley Road in Dennis White Hall from 8 a.m. To register, send an SMS starting with hashtag #TheRAF, your name, county, and talent to 22232 to get an invite to the auditions happening near you. For more information, please call 0709-861-223. Remember to carry a copy of your national ID to the auditions. The RAF, identifying talent, inspiring passion.
Every Wednesday at 7:30 p.m. Spotlight.
Do you feel that they are in a place where they can effect a Barack Obama moment?
When you hear the word of God and you hear Jesus is speaking.
Real talk on real issues.
You know, the Bible says faith without works is dead.
The truth of the gospel that will survive the time is not a health and wealth gospel.
When there is time to harmonize and bring one composite amendment.
With idealistic, thought-provoking guests.
So people come to be serviced, to be encouraged, to be empowered.
When the storm is over, you desire the closeness you have with God.
Hosted by Reverend Edward Furi. Hope TV is where you look and live, with an excellent selection of the best Christian programming consisting of local and international content, of inspirational stories, talk shows, Bible commentary, youth, health shows, children entertainment, contemporary gospel music, extended times of worship, live broadcast, news, movies, drama, Christian ministry programs, and so much more. Hope TV is another quality service from Christ is the Answer Ministries, with over 45% of authentic and credible local content every week. Hope TV is a sister station to Hope FM, Kenya's leading Christian radio station, with footprints across the country. Tune in to Hope TV, where you look and live.
Hope TV is now available on GoTV Channel 103, Zuku Channel 873, Signet Channel 817 and Star Times Channel 026. Enjoy our uplifting content and family-friendly programming anytime. Hope TV, you look and live. This week on Testify.
There are days I would party and drink until about 6:30 a.m. and go straight to work. Yeah, because I didn't want to come home now, because now my dad would have so many questions.
Right.
So I would just go to work and then do a power nap on my desk until 8 a.m. when it was time to start working. So from July 2016 to February 2020, I was homeless on the streets of Kampala.
Wow.
Yes, about three and a half years.
On the streets?
Years. Yes.
Only on Hope TV, where you look and live.
Welcome back to Health Check right here on Hope TV. Look and Live. My name is Grace Mutiso. I'm hosting Dr. Anthony Ndiritu. He's an oncologist, and you're talking about breast cancer. Remember, October is the Breast Cancer Awareness Month, and you need to know, what do you need to do to check yourself? We've talked about self-examination, and, you need also to visit the doctor to be checked properly in the clinic. So I hope you're planning to do that if you have not. And remember, this is the hour we get to your questions. Our SMS line is 22232. That is 22232. At Hope TV Kenya is our handle on Facebook and YouTube. We are live right there. We'll also be sampling some of your questions. Before we go back to the discussion, Dr. One of our viewers writes and says, what's the relationship between breast cancer and rheumatoid arthritis? Which comes first?
That is a very interesting question, but I think there is no relationship between the two. Probably the only relationship you may bring, they are not the cause and the disease relationship. Probably is the kind of population the arthritis may affect, but there is no cause relationship to that. Probably it's just a coincidence of somebody having this and the other one having that.
Okay.
Yeah.
Okay, thank you. Another one asking, Rogers, who calls you his mentor, I'm sure maybe you know Rogers, is asking, Dr. What's a great topic here. What's the life expectancy of a person with stage 4 breast cancer?
Yeah, I think that's a good question from Rogers. Unfortunately, I may not really give him an answer to that because there is no specific life expectancy that we may put on that. Remember, when you talk of breast cancer stage 4, we're talking of cancer that could have spread to any organ. And depending on the organ and depending on the aggressiveness of the disease, the life expectancy may be quite different. You may find that there are patients who have metastasis to a very small localized area. And sometimes we may be able to focus on that tumor that has spread to another area and cure it. Huh? Yes. And they have a prolonged, what we call survival. You find patients who have cancer that has spread to the bones and it has not spread anywhere else. We tend to treat them like a patient who has cancer that has not spread. The reason being, we are able to control that cancer, and they are able to live for very many years with the cancer being controlled. So there is no specific number that I can attach to the life expectancy because of the cancer having spread, being stage 4. It depends on many factors. Where the cancer has spread to, how aggressive. Remember, different cancers have different types of biology. Yes. There are some which spread very fast. There is another one which may be advanced, but it is under control. So there is no direct answer to that.
Yeah. Okay. You know, as you are answering that, another viewer wrote and said, following very closely this discussion, I am a survivor of stage 4 cancer and I'm doing well. At least a positive report right there. Thank you, our listener, our viewer for writing in. Another viewer writes and says, hi, Dr. Ndiritu, for hormonal therapy treatment, does the, a tough name here, let me try read it.
Yes.
Palbocilbe,
Cycrib,
that one, and fluvenstrant, that one, injection need to be administered on the same start date of the cycle. I don't know if they are related to cancer treatment. Are they supposed to be administered on the same start date of the cycle?
Okay, I think let's start with the first one who talked about stage 4 and it's cancer-free. I think she's supporting the point I said, that depending on the cancer that is being treated, it may be put under control, depending on where it is, and also how well it is responding to the treatment. So it is very encouraging to have such stories, and I think such survivors should be at the forefront to help us encourage those who may be diagnosed with the cancer. I don't want to come to the specifics of the treatment that the viewer is talking about, but it is one of the forms of cancer treatment that we use. But I would not want on the show to give a direction on how the medicine is administered, because somebody is under care of a certain oncologist, and I would want that to go through the oncologist who is treating. But it is just exposing us to the fact that there are many options of treatment that patients can access, even when the cancer is advanced or even at the early stages.
Okay. Yeah. So, our dear viewer, please check with your oncologist. Please do that so that you can get clear direction on that treatment. And please keep your questions coming on 22232, that is 22232, or at Hope TV Kenya on Facebook and YouTube. On the comment section, we'll be sampling some of your questions on that platform. So let's go, Dr. Anthony. A patient has come, done all the tests, final results are out, and yes, the breast is cancerous. So how do you break the news, and where do they start?
When you're talking of cancer, remember, these are what we say it is a heavy diagnosis if you're told you have cancer. Of course, the first thing you get is shock. So you don't come like the way you would come to my clinic and I tell you, by the way, your malaria test is positive. That is not one of the diseases that you disclose like that. You start from the beginning, from when the patient presents to you. I have a lump here. The counseling starts there. That is where you would talk about what are the possible things. Remember, I said majority of the lumps are not cancerous. So you don't want to start scaring the patient that you have cancer, but you counsel them from the beginning that it may turn out this, to be this or that. So that when you come now to receiving the results, you're able to discuss the possibilities because you had explored them earlier. Probably at the first visit, you may not be able to exhaust that. It is a continuous kind of education that you give the patient and counseling. You may even send them to a counselor to dig into it further, because you want them to, first of all, understand the diagnosis, understand what it means, understand that there are options of treatment. You want to counsel them about the options you have for them depending on the stage they are. Remember also the treatment. The treatment also has many other things that need to be brought into focus when you're discussing. You want to discuss things about the toxicity of the treatment. Apart from the toxicity, it affects the families because it is sometimes the treatments are expensive.
What do you mean by toxicity of the treatment?
Toxicity means the side effects of the treatment.
Okay.
So you have any side effects that we use heavy terms, toxicity.
Break it down to a jiku.
Yes, any treatment we give you, it's a poison, it's a toxin. So that is what we mean. So there are those side effects of surgery, of chemotherapy, and any other form of treatment. So counseling comes to all that. You also need to involve what we call the social workers, because you want to see that apart from the patient, the family is brought in. Because remember, there are emotional issues there are socio-economic issues there. So all those are handled. It's a long journey that you have to go through with the patient. It's a big team that goes that journey with the patient. So it is not a one-time thing.
Okay.
Now you have found the diagnosis. You have discussed with the patient and the family. You have made them understand this is confirmed to be cancer. Remember all the scans that I said. So you're able to tell them now this is the stage of cancer. And then now the first thing is to tell them the journey. You will start with this form of treatment. Probably you'll start with surgery. After surgery, we'll go to this. After this, we'll go to that. Then you give them a chance to ask questions on what it entails to go through that. Then you give them a time to digest that information. Then you begin the journey. Yeah.
Okay. So allow me to ask that, because you're focusing on breast cancer, on whichever stage will one lose their breast? Or it varies depending on how it's spread? At what stage will one say, now for this one for sure, unfortunately we have to let go?
Yeah, that is an aspect. It's a very good question, because it's an aspect that sometimes if you're not very careful, you may ignore. And it is not easy for a lady to lose her breast.
Yeah.
So it is a very important thing. And sometimes when the lady is very scared, they may not mind losing the breast, but when they are cured, now they start worrying about this missing breast.
Yeah.
And it is not all stages that we have to remove the breast. In other stages, we may remove the lump, what we call breast conserving surgery.
Yes.
And that is in the hope of you remove all the tumor with a margin of normal tissue so that you know you have removed the whole cancer, and then you conserve the rest of the breast. And of course, conserving is not just conserving a breast. You want to conserve a breast that is also cosmetic. You don't want a deformed breast and you're telling a lady you have conserved the breast. So there are special surgeons who do those kind of surgeries.
Yes.
And they can also do what they can reconstruct the breast so that it appears normal like the other. So that is breast conservation.
Yes.
Also in the more advanced stages, we may be able to give you some treatment before, like chemotherapy, and we shrink the tumor and it becomes small enough to be removed without removing the whole breast. Of course, it also depends on other factors.
Yes.
What is the size of the tumor versus the size of the breast? Remember, ladies have different sizes of breasts.
Yes.
You may find the tumor is so big, even the breast tissue you're saying you're leaving behind does not really leave a good outcome in terms of cosmesis. So sometimes you may be forced to remove the whole breast depending on the size of the breast. Of course, if the tumor is very extensive or it is very big, then you may also not be able to conserve it. Or maybe you go for the lump.
Yes.
But after you examine whatever you have removed, you find there is still some cancer left. You try to remove all of it, you still find the pathologist tells you you have still left some cancer cells behind. Sometimes we are forced to remove the whole of it so that we don't leave you with a breast looking very nice. And after a few months, we tell you the cancer has come back.
Yeah.
So those are the factors we consider when we want to know, or when we advise a lady you need to have your breast removed.
Okay.
Yeah.
Let's go back to some few questions that have come in. Hi, Dr. Ndiritu, kindly advise on diet for breast cancer survivor, what to eat and not to eat to clean toxicity. That's a tough word. Jargon, yes.
That's an important question. And not just for survivors, even for cancer patients in general. And why I'm saying it's important is because there are very many myths about diet. And you find a lot of patients are restricted from eating this kind of food, this kind of food, this kind of food. And generally what I tell my patients is that you have no diet restriction because you have cancer in general. unless there is a cancer that is affecting your liver. We tell you reduce on this, but generally, cancer patients should be able to eat a healthy diet like any other person without cancer. And I mean a cancer patient who is on active treatment or a cancer survivor. So there is no diet restriction. But remember, like we said, we are talking of a normal healthy diet. Because they need proteins, they need starch, they need vitamins, they need all those nutrients. It's a normal healthy diet. So they are able to eat anything that anyone else is eating. Of course, you want to avoid smoking and alcohol, and I don't think that is part of diet.
It's not at all, sure.
Yeah.
Okay.
Yeah, so what I'm encouraging is that there is no dietary restriction. But remember, if you have diabetes and you have cancer, don't say Dr. Ndiritu said I can take sugar.
Yeah.
Follow the doctor who is managing your sugar
Yes.
on the diet he has given you.
Okay.
Yes.
So it's important to follow the diet the doctor has given you.
The doctor has given you. But remember, there are many other doctors in quotes, especially your neighbors, your relatives. There are very many.
Yes.
And my patients are usually very happy when they come to report what they were told. 'Cause
Yes.
you get a chance to educate them. Yeah, so patients will be advised whatever they'll be advised there, but always confirm that with your doctor.
The professional doctor.
If they tell you don't take milk, go and ask your doctor. And I tell you, take your glass of milk when you want to take one. Yes. Yeah.
Okay. So we have a minute to go, Daktari. We have to wind up. Unfortunately, Vicky from Kikuyu, in a minute, Daktari, because you have to wind up, is asking, I just want to understand, why do some people get cured from the cancer and others don't even try, and yet they are on the same stage? They just pass on. What happens in a minute? Like all of them are stage 4, but this one doesn't make it, this one survives.
Exactly. I think that's why I talked about cancers being different.
Okay.
It is the biology of cancer. Okay. You can have 2 patients with breast cancer, but the biology is different. Another one progresses very fast, even one who is very early stage. You're treating, and the next time you find it is spreading. Yeah, so it depends on the biology of cancer and the effectiveness of the treatment, and also how the patient was taken from the time of diagnosis. Remember, there are many people who may misdiagnose patients out there and maybe not manage it appropriately. So you need to go to a center where if it is surgery, it is proper surgery. If it is chemotherapy, you know that is what is needed at that time.
Okay. Yeah. And the key thing here, please see an oncologist. See ule daktari wa village. So where do we get you, daktari, for those who'd like to get in touch with you?
For me, I'm an oncologist. I operate mainly in Nairobi. My practice is called Kilimani Cancer Center. It is at a building called Fortis Building, Fortis Suites, that is on 8th floor. Generally, I also treat cancer in most of the hospitals in Nairobi. So you'll find us also in Nairobi Hospital. You'll find us in Kenyatta National Hospital and other areas where cancer is treated, MPSHA and all that. But basically, if you want to get a consultation, come to Fortis Building, that is next to Kenyatta National Hospital. It is on 8th floor.
Okay.
Yes.
Thank you, Daktari. That's all the time we had today. I believe our viewer, you have learned a thing or two about breast cancer. But the key thing, please, self-examination every day. Make it a practice to examine yourself daily, and also go for checkup to a proper doctor, to a proper hospital, and get checked, because cancer is curable. It's not a death sentence, doctor, isn't it?
It is not.
It's curable.
It is curable. It's very curable.
Yes.
Yes. And remember, even those that are in stage 4.
Yes.
You have had somebody who has said he's cured of the cancer.
Yes.
What we mean here by cure is that you have a long survival. You may live for long, even when the cancer has spread. So the key thing is seek appropriate health care.
Okay. Thank you, Dr. Please seek appropriate health care. My name is Grace Mutiso. It's been a joy to be with you today as we were discussing about breast cancer. Remember to catch a repeat tomorrow at around 11 o'clock. Yes, right here on Hope TV. And, on Facebook and YouTube, anytime, any day, and spread that great message to everyone. God willing, giving me life and breath and you life and breath. We meet again right here on Hope TV next week on Tuesday, 7:30 all the way to 8:30. Stand by for Chiriku, and thereafter we have News Watch with Kennedy Kimani. Have a blessed night.